Fed up with looking in the mirror and not liking what you see? Discouraged that your workouts are not delivering what you need? Sick and tired of feeling sick and tired? Then it's time to take action. Add DIM to your supplement menu and stop letting estrogen rob you of your manhood. Ask any doctor. They will tell you the grim fact. Their male patients over 40 have many complaints that they never suffered from in their youth. Depression, weight gain, with an increase of slabs of ugly disease-producing blubber. Shrinkage of muscles and loss of muscle tone. Moodiness. Dry, wrinkled, weathered skin. Never-ending joint aches and pains. Hair loss, constant fatigue, which takes a terrible toll on every aspect of their lives. Loss of sex drive. The parade of horrors just continues, seemingly without let-up. Worse, all too often, they are told that it's only aging, and there's nothing to be done about it, so deal with it. Sadly, too many men believe this sad refrain: give up and throw in the towel. You've searched and searched, desperate to do something, almost anything, to reverse this nightmare of seeing and experiencing the disintegration of your manhood. And you've discovered something that looks promising: testosterone replacement therapy, or TRT. Next, you've decided to take action and have come to our clinic. Great! You are exactly where you need to be. We are proud to offer the most effective, cutting-edge hormone replacement therapies available anywhere in the world. We will individualize a testosterone replacement therapy program designed specifically for you. We will provide you with everything you need: the right substance, the exact dosage, and monitor your progress with safety and positive results as our 1-2 goals. At our clinic, we believe in a total holistic approach. This includes nutritional guidelines, exercise programs and supplements, and used together, we deliver results quickly and safely. As part of this approach, we must first stop the loss of your testosterone levels. To accomplish this, we consider every cause of your low testosterone, or low T. There are many causes of low T: prescription drugs, stress, junk food and beverages, recreational drugs, poor thyroid and liver function, lack of sleep, and one of the biggest causes that is often overlooked: the increasing levels of estrogen in the aging male body. Estrogen is defined as, quote, any of a group of steroid hormones that promote the development and maintenance of female characteristics of the body, end quote. For our purposes, remember the simple formula: as testosterone levels drop, estrogen levels rise. When you think about it, this makes perfect sense. Testosterone is the ultimate male hormone and is responsible for masculine characteristics, i.e., deep voice, muscle growth, body hair, etc. So how does estrogen gain a foothold in a man's body? One of the main culprits is our modern-day environment, which is jammed-packed with estrogen traps like food additives, pollutants like lead in paint, mercury, and pesticides, phthalates, chemicals used in many household air fresheners and deodorants, and plastic containers loaded with bisphenol A, or BPA, a synthetic compound with several adverse side effects. Shampoos, soaps, and detergents. Garden hoses. Shower curtains. Yep, believe it or not. Pesticides. And more, much more. Seemingly innocuous items that are estrogen bombs. All of these traps cause our estrogen levels to accumulate over time, with results that are most unpleasant: increased blood pressure, fat accumulation, weakened immune system, mood swings, birth defects, increased prostate size, and manufacturing prostate cancer cells, and lowered testosterone levels. All of this leads to the dreaded dad body. Estrogen is fed to farm animals to help them gain weight, and soy products are estrogen loaded. So Go to our website and reread the list above, and remember that there are many more household items that contain estrogen, too numerous to list. In short, estrogen is advancing like an invading stealth army in darkness, with you in its crosshairs. What all of this means is this: our testosterone levels are under constant attack from a wide array of sources with potentially dangerous side effects. If that weren't bad enough, many doctors are not aware of this hidden danger. To be fair, this topic is not covered in the curriculum of medical schools, nor is it a hot topic in the tons of medical journals that our overburdened physicians are forced to wade through. So your doctor may not be able to help you deal with rising estrogen, in spite of his or her good intentions. Even more insidious, consider this: estrogen is invisible. You can't see it, feel it, or even taste it. However, it invades your system regularly and sneakily. One more problem to consider. Don't think that the label BPA-free means that the product is harmless. The replacement chemical is something titled bisphenol S, or BPS, and can be every bit as disruptive and damaging as BPA. It has a slightly different chemical makeup from BPA, and that gives manufacturers the green light to plaster the BPA-free labels on their products. But in reality, the health hazards are still there. Therefore, to make sure your TRT delivers the maximum benefits, we need to set the table by making sure nothing is standing in the way of your treatment. The usual ratio of testosterone to estrogen in healthy men is 10-1. But due to the factors mentioned above, at times the level can swing dramatically in favor of estrogen. This ratio is intolerable and must be stopped, dead in its tracks. DIM is the abbreviation for diindolylmethane. This substance is found naturally in plants, especially vegetables in the cruciferous family: broccoli, asparagus, cauliflower, cabbage, and Brussels sprouts. Like charging reinforcements onto the battlefield, DIM attacks estrogen with a vengeance, smashing it down into less hazardous substances and neutralizing the hideous effects of this feminizing hormone. There are two types of testosterone circulating in your blood: free or bound to carrier proteins. In particular, it is the sex hormone binding globulin SHBG that is the carrier protein. Free testosterone is what we want, since it can cross the blood-brain barrier and also enter muscles and fat cells where it does its beneficial work. Regrettably, only a small amount of testosterone, 2% or less, is free. Therefore, the majority of testosterone is bound to SHBG. This is unfortunate, since it is unable to fulfill its vital functions. Here's where DIM comes to the rescue by beneficially affecting estrogen metabolism, thus allowing a higher level of free testosterone to circulate in the blood. This is accomplished by lowering the level of SHBG. This happens as a result of DIM's ability to speed up the metabolism of estrogen, decreasing unmetabolized levels of estrogen and increasing the levels of 2-hydroxyestrogens, a beneficial substance. This is important since 2-hydroxyestrogens have the keys to spring testosterone from the jail of SHBG and let it loose to go to work. The thing to remember is this: DIM delivers a 1-2 punch. It slashes unmetabolized estrogen levels and raises 2-hydroxyestrogen levels. This powerful dynamic duo is what helps to provide testosterone's youthful restorative benefits. As men age, estrogen metabolism slows naturally. When coupled with all of the environmental impacts, the need for the body to clear excess estrogen becomes life-saving. Also, DIM has been proven to slow the growth of prostate cancer cells to a crawl by as much as 70%. Here's why. As men age and the estrogen or testosterone balance becomes more and more out of whack, excess estrogen accumulates in the prostate. Research has shown that this ramps up the production of prostate-specific antigen protein, or PSA. The level of PSA in a man's bloodstream is a standard screening test to uncover the severeness of prostate size increase and therefore the risk of prostate cancer. Estradiol, the active form of estrogen, is directly linked to an increase in the prostate gland's manufacture of PSA. Fortunately, this deadly effect can be neutralized by DIM, stimulating an increase in beneficial estrogen metabolites, substances formed in or necessary for metabolism. The last thing in the world any man needs is prostate problems. DIM is a safe, inexpensive addition to your prostate protection arsenal. It's not just men who can benefit from DIM. Studies have uncovered that women diagnosed with uterine and breast cancer have low levels of 2-hydroxyestrogen. the right kind, and excess levels of 16-hydroxyestrogen, the wrong kind. High levels of 16-hydroxyestrogen are made worse by the environmental causes mentioned earlier and are as debilitating to women as they are to men. DIM promotes a healthy estrogen balance since it boosts the level of the good 2-hydroxyestrogens and lowers the level of the bad 16-hydroxyestrogens. This can potentially slow down or inhibit serious illness. Also, many women have reported improvement in premenstrual syndrome, or PMS, after supplementing with DIM. Again, the evidence points to DIM's ability to restore the correct estrogen levels that are unbalanced with PMS. It is important to add cruciferous veggies to your diet. However, it would be extremely challenging, if not impossible, to obtain the amount of DIM needed to produce its protective benefits, at least 2 pounds a day. Therefore, it is recommended to consider taking DIM in supplemental form to ensure your levels of this vital protector are adequate to deliver its benefits. 200 to 400 milligrams of DIM daily is the preferred recommendation. Clean, smart eating combined with DIM supplementation equals the winning formula. This safe, inexpensive supplement will set up the right environment for your body. An environment that will ensure you'll obtain maximum benefit from your testosterone replacement therapy program.